Every Tuesday and Thursday, we are joined by an infectious disease specialist to bring you the latest developments and research on COVID-19.
That's Dr. Dana Hawkinson from KU Health. Doctor, as always, we're glad to have you this morning.
Hi, thank you.
We wanted to know the latest number of COVID-19 patients the University of Kansas Health System has this morning. You guys put those numbers out on a regular basis. What's the status this morning?
Yeah, as of yesterday, we had 16 in the hospital. 7 of those were in the ICU. Our numbers have gone down over the last week and a half from about 31 down to about 16 now. I don't know what the exact numbers are today, but that's where we were yesterday afternoon. And that is from a high of about 41 a few weeks ago. So we expect our equilibrium number to be around 20 to 30. Hopefully not any more than that, and certainly we would love if it's less than that.
Well, that decline, Doctor, kind of matches what we are seeing in the new cases reported each week in the states. In Kansas, between the first and second Tuesday of May, there were 1,670 new cases reported. Between the second Tuesday and now, that number went down to 1,149 new cases. In Missouri, the decline is more gradual, but still seeing a decrease of about 19 cases in that same time frame. So, Dr. Hawkinson, we're seeing these numbers of new cases start to go down. Does that mean we can start to change our behavior back to pre-pandemic levels? Can we start to let our guard down a little bit?
Yeah, I would say we can't start to let our guard down. Absolutely not. I think this is going to be a very important time as we are opening up. Those numbers are probably all a reflection of, number one, probably some of the clusters at the food processing plants and the other places of employment. But also it's a reflection of the early stay-at-home orders and people staying away and not being in public. So once you get in public, you will have just a lot of people who haven't been infected who are still able to be infected. The virus can spread very easily. We absolutely cannot take our foot off the gas pedal. We need to continue to be vigilant and do the right thing.
Doctor, we're trying to track the cases locally as best we can here at 41 Action News, and according to what we've watched, Wyandotte County has seen the most deaths so far and the third highest amount of cases in the state. Right now it remains in the red phase of reopening, meaning salons can't open their doors to the public yet. But we've talked out about how to stay safe in a salon, following certain guidelines. I got my hair cut this weekend, had to wear a mask the whole time. My barber was wearing a mask. But with so many cases in Wyandotte, does it make sense for Wyandotte County to be even more cautious? Are they still in that area where they have to take extra precaution because of the numbers being so high?
Yeah, you know, throughout this, we've always maintained it's a step-by-step process. It is a lot about overabundance of caution. I think certainly with the numbers, it's very important to continue to do those things, to take it very, very slowly. Really, the goal is to protect the public, protect everybody's health. There is the optimal things we need to be doing. There is the reality of businesses being able to open, people wanting to open up, but we have to kind of check against that and really continue to try and do the optimal things, really to keep people healthy and keep people out of the hospital.
Doctor, how certain are you that we will see an increase in cases or not now that stay-at-home orders have been lifted locally?
You know, certainly from the past experience of other countries, of New York, of Detroit, in the United States, we have to assume that the virus is out there, and if it's out there, it will find susceptible hosts to infect. We know that the majority of these infections will not have to seek medical treatment, will not have to go to the hospital. But even so, if you have a lot of people infected, those small percentages could add up to big numbers. So we certainly do expect another surge and wave. We are prepared for that. We continue to prepare daily. We hope it doesn't come. That would be a best case scenario, but we still prepare as if it will come.
Doctor, thank you so much for joining us. We'll talk to you again coming up at 6:45.